For neck pain or for any symptoms in the upper body that are coming from the neck, cervical or neck retraction is a common repeated movement test I will use for patients. And again, like any repeated movement test, if it's shown to be effective at reducing signs and symptoms, it can therefore become the treatment. Cervical retraction usually requires some overpressure through the chin to get to end range. Patients usually apply that overpressure themselves, but as a test in the office, I can apply that overpressure as a clinician. It's a more global force, pushing from the chin and kind of encouraging all joints that are moving to move a bit more. Another option is using a towel or something similar to apply a counter force to the mid-cervical spine at end range, or any place in the range that you want. I find getting to end range in testing and treatment is paramount, however. Some people may know this as a mulligan snag, but there are different terms for different ways people use things. In Mackenzie's philosophy, which I use in addition to other concepts of orthopedics, of course, in his philosophy, most disorders can be fixed by taking the joint to end range in a specific direction, restoring the joint mobility to normal, restoring mechanics to normal. And because it's one movement or possibly two that's really effective, it's performed throughout the day. And we're not doing other things as well because the root cause will be addressed with just this one or two movements. But using this, if I think that the problem is a neck disorder and it's joint related and I want to stay in the sagittal plane, meaning I don't want to go into rotation or lateral flexion, this is an option I may use for some patients. Part of my thought process for when I would use this as a repeated movement test is if I think it's in the sagittal plane, I think it's a joint, and I think it's in the mid-cervical spine, and cervical retraction, kind of the first line approach, just cervical retraction with overpressure is not helpful, or retraction extension is not helpful, either in sitting, supine, or prone, then I may want to focus in more on the mid-cervical spine and get some overpressure using the towel. You can use something similar. I'm fine with something that's a few inches in height, meaning it takes up the bulk of the mid-cervical spine. It just looks like this. Patients are going into retraction and then giving themselves that counter pressure, that force to help mobilize more into the motion. So if those criteria that I mentioned are met, this can be a repeated movement test that I have patients do. We'll do it 10 or so times, just like any repeated movement test, and then check the baselines. For example, neck range of motion, or muscle strength in the upper extremity, or nerve tension, or functional movement. And of course, we'll test symptoms. What happens after we do this? Is there a change or no change? Is it worse, better, about the same? If I do 10, 20, 30 repetitions, and I see that we're trending in the right direction in a significant observable way, when we look at the whole picture of all the signs and symptoms, then it becomes something that I want to test several days, meaning every couple hours for a few days, to really see if this is the specific movement that your joint needs to get better.